let's use plain numbers. Say, for example, a 200 employee company. Let's say they have an expected medical bills of about 2.8 million for the coming year. And then we call this the 3 layers of renewal protection. So this is really kind of the formula for that. So layer 1 is the specific deductible, also known as a spec deductible. And the company agrees to pay the first amount of any one person's medical bill. A lot of times when we move employers from fully insured to self-funded, the first year is setting that spec deductible very conservatively, usually around $75,000, maybe in some cases $100,000. After several years, you might, bump that up a little bit because you got some surplus, but we always start conservatively. So that's layer 1, setting the spec deductible. Then layer 2 is your aggregate cap. And this is the protection in place so the company's total medical bills for the entire year never exceed a maximum amount. Usually it's set up you take the expected times 1.25. So it's usually 25% more than the max expected. And in this case, it would be $3.5 million. And then you have the captive layer. So as part of a co-op in a captive, this is a shared layer, often through various captives that we utilize, and that has the benefits of helping with costs above the specific spec deductible, and it smooths out volatility across the years. So if you have bad years with, say 4.4 million in claims, and the aggregate cap limits your exposure to 3.3 million, and the stop loss covers the rest, the following year, the renewal is based on actuarial smoothing, not panic repricing. So the increase that you might deserve is even lower because of that captive protection. And it's usually modest. Often we see the majority of them being between 3 to maybe max of 8%, instead of, if you were comparatively on a fully insured plan, would have easily be 20% or more.